Any surgical procedure may cause concern on the part of a patient. That concern is heightened when you're talking about a major procedure such as a total knee or hip replacement. But as Rod Starnes shows you in our cover story, the team at Baptist Collierville is making sure these surgical patients are benefiting from some advanced education.
Thank you again. We want to welcome you to Joint Venture. The reason we call it Joint Venture is because obviously you are having a joint replaced, either your hip or your knee. But it's also an opportunity for us to have a joint time with you all.
Class is in session here at Baptist Collierville. And like any class, there are lesson plans, demonstrations, and questions. But there's no graduating here. This class is designed to help these patients prepare for their upcoming knee or hip replacement surgeries.
Almost all of our patients that had total hip and total knee used to go to inpatient rehab upon discharge, and now they don't. The majority go home with home health care or other community resources. So we felt like since the patients are in the hospital such a short period of time, they really need to know what to expect.
The Joint Venture class is also designed to address something else healthcare workers discovered, that the more you're prepared before you even get to the hospital, the faster you can recover, and the easier you can make it on yourself and your family at home.
We try to call patients 2 weeks to a month before their planned surgery and get them to come to class and bring a support person with them, whether that's a spouse, family member, a friend, whoever be helping take care of them when they go home.
Come on, ladies.
Terry Newman is one of those patients who got the call. Back in 2001, Terry had total replacement of his left knee, so he kind of had an idea what to expect for his next go-round when his right knee started bothering him. But with so much time in between surgeries and so much to keep in mind, a refresher course couldn't hurt.
I was real enthused about going through it. It'd been 8 years, so I had forgotten so much stuff that I was going to go through. Just different things that CRS, can't remember stuff, had taken place and I'd forgotten.
The class is held right at the hospital, so a post-meeting tour is available if you'd like. And in just 2 short hours, the entire spectrum of your health care is covered, starting with home preparation.
Who thinks about the glass being up in the top of the cabinet, you can't get a drink of water? Who thinks about a throw rug that you've got beside your bed that, hey, if I get up out of the bed in the middle of the night, I could fall?
Even ACE merits a mention in the Joint Venture class.
Oh, that's one thing that I had forgotten about. Dogs like to run out the door when Daddy comes home. And we had to start watching when I'd come in, otherwise he'd knock me down. And the one thing that you do not want to happen is have a fall.
We really want people to go home to a safe environment. That's what the class is all about, is to reach out to our patients to give them the information they need. The nurse talks about pain management, and we talk about infection control measures.
Okay, can everyone see this? Over here is a vial of medicine.
The occupational therapist goes over with them several exercises they can be doing, and we talk about the equipment they're going to need.
You're going to slide your foot all the way down to the bottom, and then you're going to pull.
A lot of material is covered, a lot of questions are answered, and a lot of anxiety is relieved.
Excellent, very informative, brought me up to speed on what's going to happen in pre-surgery, during surgery, and post-surgery, so it was very informative, helped me out a lot.
The class was good. It was really interesting.
The thing I think that would benefit me the most is just not being as scared and knowing what to expect when I get here and when I wake up.
Knowing what to expect and preparing mind and body ahead of time were critical factors that helped Terry get back on his feet and back to his favorite activities.
I'm part of a mission team. We've been able to establish orphanages, churches, schools. I'm looking forward to going this year because I should be able to run and play with the children and do the things that normally the old man of the group doesn't get to do. When your legs hurt real bad, knee replacement is a wonder. I would recommend the class to anybody that's even thinking about having the surgery.
Come on, Ace.
For Smart Medicine, I'm Rod Starnes.
The joint venture class is open to anyone, regardless of what hospital you choose for your procedure. If you'd like more information, call 901-861-8963 or visit WKNO.org and click on the Smart Medicine icon, or check out smartmedicine.tv.